I'm really interested in looking at psychological factors related to chronic pain, and it's particularly looking at people with rheumatoid arthritis and other forms of inflammatory arthritis where there may be a shared component between mental health and the pain experience as part of the condition. My research is really trying to bring in kind of psychological factors and thinking about their mental health and also other kind of things related to mental health, so to do with kind of exercise and social functioning, and really trying to bring that into the rheumatology clinic. And so what we'll be doing is we'll be trying to bring in some of this extra information in a structured way so that it's there available for the clinicians and the nurses to really identify what the key issues are for the person and help to target their therapy. So arthritis affects people of all ages, so there's osteoarthritis, affects people who are generally older, but inflammatory arthritis can affect someone of any age. So it's really important to think about trying to intervene and develop ways of working with people early on so that if they do have a chronic physical condition, that they can adapt their life and it doesn't have kind of negative consequences going forward as part of their adult life. It's a no-brainer that mental health science deserves investment. It's something that affects all of us, and there's a real lack of funding compared to other conditions. So we've really got to push and really swear to develop mental health funding in this area so we can drive forward our understanding and develop treatments and make lives better for everybody. My biggest ambition is I'd really like to develop the research in the area so we can try and bring us some of the really interesting psychological research that we know and marry that up with a lot of the really interesting treatment-related biological research that we know from arthritis and try and put them together, because I think all together it will be greater than the sum of its parts and we can really improve the quality of life for patients. I think really the main challenges with mental health science are a lack of funding. There's a huge lack of resources. There's huge needs but no resources within the NHS for treatment, but also for research funding as well.